If your legs feel heavy when you climb the stairs, if cramps rip through your calves at night, if your feet burn, tingle, or keep falling asleep, or if you feel just a little more unsteady on uneven ground, don't ignore it. I'm Dr. Serena Serrati, and I want you to know that after 60, these leg and foot changes can be early clues of 5 specific nutrient deficiencies that often show up in your legs first, long before anyone thinks to test for them. In this video, I'll walk you through vitamin D, vitamin B12, vitamin B1 or thiamine, vitamin E, and magnesium as our honorary vitamin, so you know what to watch for, how they tend to feel in the legs, and what to ask your own clinician. By the end, you'll have a clear plan for a safer conversation and checkup, not a do-it-yourself supplement experiment. Let's start with why your legs and feet are such early messengers. Your heart is the power plant, and your legs are like the farthest streetlights on an old electrical line. They're the most distant from the source, so if the power drops, those lights flicker first. The longest nerves in your body run from your spine all the way down to your toes, and those long fibers are very sensitive to small changes in vitamin levels and blood flow. Your leg muscles also work constantly to keep you upright, balance you, and move you safely, so they feel it quickly when energy production or nerve signals are just a bit off. Over months or even years, little shifts in circulation, nerve health, and muscle metabolism can show up down there before they become obvious anywhere else. Now we'll move through each deficiency, one by one, always linking back to how it may feel in your legs. As you listen, quietly compare what you hear to what you're actually feeling day to day, without jumping to self-diagnosis or panic. Think of this as learning a new language your legs might be speaking to you. Then, we'll turn that information into specific, respectful questions for your clinician so you can get proper testing and tailored advice. Vitamin D is the first one, and it's far more than a bone vitamin. When vitamin D is low, many people over 60 notice a deep ache or heaviness in their thighs or hips, or a general sense that their legs are weak and don't quite want to cooperate when they get up from a chair. Climbing stairs can suddenly feel like lifting sandbags, and some people feel wobbly or unsure on their feet, even when they're on level ground. For a portion of people, very low vitamin D is also linked with nerve-type pain, such as burning or tingling in the legs or feet, which can easily be blamed on just age or just diabetes. Inside your body, vitamin D helps regulate calcium handling, supports muscle fiber function, and may influence how nerves communicate and how pain is processed. When levels are chronically low, muscle strength and reaction time can drop, and studies suggest that fall risk can climb significantly in older adults with deficient vitamin D compared with those at healthy levels. Some research indicates that with corrected vitamin D under medical supervision, certain people notice steadier steps and less aching over weeks to months, though not everyone will respond the same way. The key is that low vitamin D quietly makes it harder for your muscles and bones to do their jobs, especially in the legs you depend on to stay independent. Your clinician can usually check vitamin D with a simple blood test called a 25-hydroxy vitamin D level. If it's low, they might recommend more dietary sources like fatty fish such as salmon, fortified milk or plant milks, and eggs, along with safe sun exposure if appropriate for your skin and medical history. They may also suggest a vitamin D supplement, most often vitamin D3. But the dose and plan should be tailored to you because too much vitamin D can cause problems, especially if you have kidney disease or certain other conditions. That's why high-dose vitamin D from the internet without lab work and guidance is not a good idea. Next is vitamin B12, a major player in nerve health and blood cell production. When B12 runs low, one of the classic early signs is burning, tingling, or numbness in the feet and toes, often worse at night, sometimes creeping slowly up the legs over time. You might feel as if you're walking on cotton, or that your toes aren't quite there, and you may start to trip over small obstacles more often. Some people also notice they feel unsteady in the dark or on uneven ground because B12 deficiency can affect the brain's ability to sense where the feet are without looking. Biologically, B12 helps maintain the myelin sheath, that protective insulation wrapped around your nerves, and it's crucial for normal nerve signal speed. When B12 is low for a long time, nerve conduction can slow down noticeably, which may translate into slower reflexes, clumsy feet, and changes in balance. It also affects red blood cell production, and if those cells are not healthy, your leg muscles may get less efficient oxygen delivery, adding to fatigue and heaviness. Correcting a clear B12 deficiency under supervision can, in some people, lead to gradual improvements in burning, balance, and walking. But nerves can take many months to respond, and not all damage is reversible. A doctor can check your B12 with a standard blood test, and sometimes, if the result is borderline, they'll add tests like methylmalonic acid or homocysteine for a more sensitive picture. B12 is found naturally in animal products such as meat, fish, poultry, eggs, and dairy, and many breakfast cereals are fortified with it as well. If you're vegetarian, vegan, have had stomach or bowel surgery, take medicines like metformin or acid-reducing drugs, or have conditions affecting absorption, your clinician may recommend B12 in pill, liquid, under the tongue, or injection form. Again, the plan should be tailored. Self-injecting or taking huge doses without understanding why your level is low can hide serious issues and is not safe. Vitamin B1, or thiamine, is our third, and it's often overlooked. Thiamine is essential for turning the carbohydrates you eat into usable energy for your nerves and muscles, especially in the legs. When B1 is low, people commonly describe heavy, tired calves, painful cramps, and a burning or pins and needles feeling in their feet that gets worse as the day goes on. Over time, walking short distances can feel exhausting, and your legs may feel like they simply don't have the strength they used to, even if you haven't changed your activity much. Inside the cells, thiamine sits right at the crossroads of energy production pathways. When it's missing, your muscles and nerves are forced to run on a nearly empty fuel tank, and the tissues farthest from the heart, such as your lower legs, complain first. In more severe deficiency, people can develop classic problems historically known as beriberi, which include marked leg weakness, difficulty walking, and even heart issues in some cases. When identified and treated early, correcting B1 deficiency can, for many people, improve leg strength and reduce cramps over weeks. But once again, it's not instant and not guaranteed. Thiamine can be checked with a blood test, though it is not usually on routine panels. So you may need to ask if your story fits the pattern or you have risk factors like heavy alcohol use, very limited diet, long-term diuretic use, or certain medical conditions. Foods rich in B1 include pork, whole grains, fortified breads and cereals, beans, lentils, and nuts. If your clinician finds a deficiency, they may start you on a thiamine supplement, often at higher doses initially, and then a maintenance plan tailored to your needs. Because B1 deficiency can overlap with heart and nerve conditions, it's important not to treat yourself blindly with high-dose thiamine. It should be part of a structured care plan. Vitamin E is next, and while it's less commonly low in people eating a varied diet, it becomes important in certain conditions. Vitamin E is a potent antioxidant that helps protect the fatty coatings of your nerves and keep cell membranes stable, especially in nerves and muscles. When vitamin E is truly deficient, people can develop leg muscle weakness, a sense of clumsiness, and balance problems, sometimes noticing they need to widen their stance just to feel steady. Numbness and tingling in the legs and feet can also appear, and walking in the dark or on uneven ground may become much more difficult. Because vitamin E is fat-soluble and absorbed along with dietary fats, deficiencies often show up in people who have trouble absorbing fats, such as those with certain digestive diseases or after specific surgeries. Over time, without enough vitamin E, the protective structures around nerves can deteriorate, and nerve signals to the legs may become less precise. That can translate into missteps, increased falls, and a constant fear that your legs will give out when you most need them. Some people, when deficiency is found early and carefully corrected, experience improved strength and steadier balance, though long-standing nerve damage may not fully reverse. Your clinician can measure vitamin E through a blood test, often looking at alpha-tocopherol, sometimes interpreted alongside cholesterol and fat levels. Dietary sources include nuts like almonds and hazelnuts, seeds such as sunflower seeds, certain vegetable oils like sunflower or safflower oil, and green leafy vegetables. Supplements exist, but high doses of vitamin E can interfere with blood clotting and increase bleeding risk, especially if you're on anticoagulants, have a history of strokes, or are preparing for surgery. That's why any vitamin E supplement decision should be made with your clinician, not on the basis of a label promising nerve repair or circulation support. Now let's bring in magnesium, our honorary vitamin here, because of how vital it is to nerve and muscle function. Low magnesium is strongly associated with leg cramps, especially at night, when painful spasms in the calves or feet yank you out of sleep. It's also linked with restless legs in some people, that uncomfortable urge to move your legs when you're trying to rest, often with creeping, pulling, or buzzing sensations. During the day, you might notice generalized leg fatigue, shaky muscles, or that your calves feel tight almost all the time. On a cellular level, magnesium is involved in hundreds of reactions, many of them governing how muscles contract and relax and how nerves calm down after firing. Magnesium helps balance calcium, which is the key mineral that triggers muscle contraction. When magnesium is too low, nerves can fire too readily, and muscles can stay tighter than they should. That's one reason cramps and twitching can flare when magnesium is depleted over time. Some studies suggest that, in certain people, improving low magnesium under supervision may help reduce leg cramps and support better sleep. But the response is individual, and not every case of cramps is due to magnesium. Magnesium can be checked with a blood test, though blood levels don't always reflect total body stores perfectly, so clinicians interpret it along with your symptoms, kidney function, and medication list. Foods rich in magnesium include green leafy vegetables, nuts, seeds, beans, lentils, whole grains, and some fish. Supplements come in many forms, such as magnesium citrate, glycinate, or oxide, each with different absorption and side effect profiles. If you have kidney disease or reduced kidney function, you must be especially careful because your body may not clear excess magnesium well, and too much can slow your heart or drop your blood pressure. That's why no one with kidney issues should start magnesium on their own. Now that we've walked through each deficiency, let's talk about what to do with this information. The goal is not to turn you into your own doctor, but to help you have a sharper, more productive visit with the clinician who knows your overall story. Start by taking a quiet moment to list your main leg and foot symptoms on paper: heaviness, cramps, burning, tingling, numbness, restlessness, weakness, unsteadiness, or wounds that heal slowly. Next to each symptom, jot down roughly how long it's been present and whether it's getting better, staying the same, or slowly worsening. Before your appointment, also write down all your medications and supplements, including over-the-counter pain relievers, acid reducers, diabetes medicines, diuretics, herbal products, and any nerve or circulation formulas you've bought. Then plan 2 simple sentences you can say when you're in the room. These are the symptoms I've been feeling in my legs and feet. Could any vitamin or mineral deficiency like vitamin D, B12, B1, vitamin E, or magnesium be contributing? And which blood tests would make sense in my case? This shows respect for your clinician's role while still guiding the conversation toward a more complete evaluation. You're not demanding specific tests. You're inviting a thoughtful discussion. Here's a gentle but important: don't do this. Don't go online, type in burning feet cure or leg cramps fix, and buy a huge bundle of high-dose supplements that promise to regenerate nerves and supercharge circulation. Those stacks often contain large amounts of multiple vitamins and minerals, which can clash with your medications, overload your kidneys or liver, or hide the true cause of your symptoms by changing blood tests before anyone knows what's wrong. High doses of fat-soluble vitamins like D or E can build up and cause damage, and extra magnesium can be dangerous if your kidneys aren't working perfectly. A safer path is, first lab work and medical assessment. Then, if a deficiency is confirmed, targeted supplementation at the right dose with monitoring. Let's also build a simple, practical daily pattern that may support your legs without pretending to cure anything. In the morning, aim for a small but nutrient-dense breakfast, such as an egg with a slice of whole grain toast and a handful of nuts, or a bowl of fortified cereal with milk or fortified plant milk and a banana. This kind of meal can offer some B vitamins, vitamin D, magnesium, and healthy fats your nerves and muscles appreciate. If your clinician agrees, add a short movement interval later in the morning or early afternoon, like a 5 to 10 minute indoor walk, or if walking is difficult, seated ankle pumps and gentle leg lifts. Hydration matters too, but it works better when it's timed kindly for your bladder. Try to drink most of your fluids earlier in the day, tapering toward the evening so you're not forced into unsafe nighttime bathroom trips. For lunch or dinner, think simple plate. Some protein like fish, chicken, beans, or lentils, a serving of green vegetables, and a portion of whole grains such as brown rice or whole wheat bread, when medically appropriate. If your appetite is small or cooking is difficult, you can lean on low-effort options like pre-washed salad mixes, canned beans rinsed under water, small portions of cheese or yogurt, and a handful of nuts or seeds spread through the day. For those who can't tolerate certain pills, consider gentle alternatives you can discuss with your clinician. Fortified foods like cereals, plant milks, or nutritional drinks can sometimes provide B12, vitamin D, and other nutrients in a way that's easier to swallow and digest. Some supplements come in liquid or under-the-tongue forms, which can be friendlier if you struggle with larger tablets. Your clinician may also suggest splitting doses into smaller amounts, taken more than once a day to reduce stomach upset, especially with magnesium or certain B vitamins, if they're appropriate for you. Let's add a simple 7-day tracking plan to make your next appointment much more powerful. Choose one main leg symptom that bothers you the most right now, such as morning stiffness, evening heaviness, nighttime tingling, or the number of calf cramps you get at night. Once a day, preferably at the same time, rate that symptom from 1 to 5, where 1 is barely noticeable and 5 is severe or very disruptive, and jot it down in a notebook or on a calendar. That's it. No fancy charts, just a daily number with maybe one word beside it. If it feels safe, you can also notice your steadiness once a day during a short, comfortable walk of about 10 meters, or roughly down a hallway. Walk at your normal pace without rushing, with support nearby if you need it, and note whether you felt steady, needed to touch the wall, or had to stop. After you've seen your clinician, had any recommended blood work, and possibly started medically supervised changes to your diet or supplements, keep tracking the same symptom for several weeks. This isn't to prove that something worked or didn't work overnight, but to notice patterns you can bring back to your clinician and say, "Here's what I've seen over time." As you go through this process, remember there are some situations when waiting is not appropriate. If you develop sudden, rapidly worsening weakness in one or both legs, if one leg becomes very swollen, red, or painful, if you have new severe leg pain with chest discomfort or trouble breathing, or if you suddenly can't feel where your feet are and you're struggling to stand safely, seek urgent care. Those can be signs of blood clots, severe nerve compression, vascular events, or other emergencies that cannot wait for routine lab testing. Vitamin deficiencies develop over longer periods. Emergencies appear quickly, and your safety must always come first. For those of you living with diabetes, peripheral artery disease, kidney disease, heart failure, or on multiple medications like blood thinners, diuretics, and acid-reducing drugs, your margin for error is smaller, which is exactly why your voice matters. You are more prone to certain deficiencies, and at the same time, more vulnerable to the side effects of high-dose supplements. That combination makes partnership with your healthcare team absolutely essential. Instead of fixing things alone, think of yourself as bringing your clinician a carefully gathered story. Your symptoms, your 7-day scores, your walking observations, and your questions about vitamin D, B12, B1, vitamin E, and magnesium. Your legs are not just limbs. They're your independence. They get you safely to the bathroom at night, help you climb the stairs instead of fearing them, and let you say yes when grandchildren ask you to come outside or walk to the park. When your legs and feet start whispering with heaviness, cramps, burning, tingling, or unsteadiness, that's not something to shame yourself for or brush off as, "I'm just old now." It's an invitation to check whether the basic building blocks your nerves and muscles need, like vitamin D, B12, B1, vitamin E, and magnesium, are truly in place. So here's your next step, if this resonated with you. Take 10 quiet minutes to write down your leg symptoms, your medications and supplements, and 7 days of symptom scores, even if you're starting today at day 1. Then, at your next visit, look your clinician in the eye and ask, could any vitamin or mineral deficiency be contributing to what I'm feeling in my legs? And which blood tests make sense for me? You're not asking for miracles. You're asking to give your legs a fair chance. If you'd like more clear, respectful guidance like this, you're welcome to subscribe to Dr. Serena Serrati in Senior Health. And please remember, this video is education, not personal medical advice, and it does not replace a one-on-one assessment with your own clinician. You deserve to have your concerns heard, your legs taken seriously, and your independence protected as much as possible at every stage of life.